Thank you for accessing our QR code and entering our website. Please explore the site for further information surrounding our systematic review. Our systematic review had two aims. The primary aim was to search for ACL Conservative Management Protocols online, ACL short for anterior cruciate ligament. And the secondary aim was to analyse and critically appraise the protocols found through the search.
New evidence emerging in the sphere of ACL injury management, although somewhat limited, is quite promising in support of a conservative approach towards these injuries. The average ACL reconstructive surgery costs approximately $8,000, not including rehabilitation costs. In addition to this, we must factor in the physical and psychological burden on the patients, plus the time cost of between 6 to 12 months of return to work or play for the patient. With the incidence of ACL injuries so high, and with surgical management being the most popular intervention of choice, further exploration into the implementation of a conservative approach is crucial. Our team scoured the literature for some form of protocol that could be followed to assist clinicians in how to appropriately manage an ACL injury conservatively, but were unable to find any such published protocols. This is why we looked to internet search engines for our research.
We then developed 3 search terms and put them into Google, Yahoo, DuckDuckGo, and Bing to see what the net had to offer. We used a private browser mode to minimize bias from previous search history and screened up until the 10 first pages or first 100 articles for each search term on each search engine. Eligible data was then screened based upon the exclusion criteria and extracted to RefWorks and secure Google Sheets. This was conducted by 2 independent assessors and 1 mediator per search engine. The screening process consisted of 3 stages. First, a link and title assessment. Second, a website preview. And third, an in-depth assessment of the website's entire contents, including target population and program characteristics. To evaluate the quality of each selected protocol, the Hong Code certification, JAMA benchmark, CERT, and FKRE were used. The results of the 4 analysis tools were then calculated to form a combined analysis score, allowing us to determine the overall quality and applicability of each protocol.
Across all 4 search engines, we viewed a total number of websites just shy of 2,400. Once applying exclusion criteria and removing duplicate websites, we were left with just 9 websites containing protocols which fit our inclusion criteria for further analysis by our research team. We found that none of the websites had attained or even applied for a Hong Code certification to verify the reliability and credibility of the information published on their website. All websites also scored on the lower end of the CERT assessment tool, with no website scoring above 50%. The common theme was that most protocols lack clear implementation methods by neglecting progression rules through different phases of the program, not clearly outlining the required equipment, not specifying the type of exercise routines, whether individually or in group sessions, or not including methods to ensure adherence. We found that readability via the use of the FKRE tool was very consistent among the 9 websites, with almost all websites scoring quite highly on the FKRE. Finally, regarding the JAMA, the majority of the websites failed to meet most domains of the scoring system and therefore scored quite poorly. When looking at all scoring tools together in the Combined Analysis Score, or CAS, the general trend was that there was no high quality information. As you can see, the top website, Digital Commons, scored just shy of 20 out of 30 on the CAS, followed by Orthosurgery, which only just reached a score surpassing 15 out of 30. All other websites scored lower than 50% on the CAS.
This systematic review's preliminary findings found that there are limited high-quality protocols online relating to conservative management of ACL injuries. The available protocols are primarily directed to health professionals and not accessible to patients within layman's language. Of the included protocols, we found that they were of low-moderate quality based on the CAS. This was a potential limitation of conducting the systematic review through an online search engine, as there are no restrictions on who and what content can be created, promoted, and published.
We conclude that ACL conservative management protocols were able to be searched online through 4 web-based databases. Preliminary findings included 9 protocols, which were assessed as low-quality evidence. Findings suggest protocols must include further details surrounding prescription intensity, specificity, and timing. We recommend future protocols to be externally reviewed and certified to ensure unbiased, reliable, high-quality health information from the net.